Hello, my name's Carol Smith from Northeast Counselling Services, and I just wanted to talk a little bit about coping strategies and are the ones that you're using helpful to you, and if they're not, what can you do to change it? So, first of all, well, what is a coping strategy? It's something we do, a behavior, sequence of behaviors, or a mental process that we use to satisfy an unfavorable scenario or changing one's response to such a scenario. And although that's a bit jargony, really what it means is the different types of coping strategies there are. We can be active, we can physically go out and, you know, go for a walk, something like that, that might exhaust us to take our mind off things. We can be accommodative. We just say, yeah, okay, well, that's happened. I can't do anything about it. And that's our coping strategy. We might become emotional. It's one of those things where, you know, if you see somebody who's been bereaved, they might use their energy to then start a campaign against whatever's bereaved them, that kind of thing. We might change our behavior. We might go in on ourselves. We might shout and scream. That's one of the coping strategies, pushing people away. And it might be in our brain, we might just make a note to build a wall around ourselves. If this happens, I'm not going to let anybody in to hurt me again. So there's some of the different kinds of coping strategies that we use. And really, you know, these are some of the coping strategies that people have said to us that they use when they come in for counselling. So using friends, sometimes people use drugs, smoking, or food misuse. Maybe they use prescribed medication, alcohol, you know, all these things people have said to us that they use. And it's worthwhile just having a think about what your coping strategies are. How do you do things? How do you stop yourself being hurt in a difficult situation or coping with change? And then we've got to ask, are all coping strategies good? Well, it might be that you feel that, you know, you feel great if you're drinking alcohol, if you're binge eating, it makes you feel a bit better. But in the long term, is that really a good thing to do? Sometimes we ruminate, sometimes we procrastinate. And those kind of coping strategies that we use, quite often they're not great for us, because the thing that we're trying to avoid, we'll have to face at some time. And so what we want to do is get you thinking about those coping strategies that you use and think about, can I change them? You know, so if you're the kind of person who builds a wall around yourself because you've had a awful experience in a relationship, you're stopping yourself being open to relationships in the future. That's something that a lot of people do. They won't allow anybody else to get in case they get hurt. So not all coping strategies are good or healthy. And if we constantly use negative strategies, the things that can happen, well, we avoid people, we reinforce the fear. We lower our educational and professional achievements because we're scared of doing things. We avoid difficult conversations, and that leads to deteriorating physical and mental health because we're holding everything in. We're not saying what we really want, and we're not getting the things that we need to improve our mental well-being. So if you find yourself using negative strategies all of the time to cope with situations, what can you do? Well, if you improve your coping strategies, it has been linked to lowering psychological distress, anxiety, depression, and overall mental health is better. Um, and they've called it maladaptive coping here. While maladaptive coping might initially appear to work, it does increase stress and anxiety over time. So what you want to do is spot those maladaptive coping strategies that you're using and start to think about something different. And these kind of things, really good is cognitive behavioral therapy, so that you can look at the behaviors that come from the thoughts in your head and change those behaviors. things like distraction, you know, I'm going to read a book, I'm going to do something that can stop those negative thoughts in your head, and just giving yourself some compassion and think about coping statements. So really what I wanted to say is, if you find that you are coping with change or bereavement or hurtful things in a way that's having a detrimental effect on you in other aspects of your life, it might be worthwhile asking for some support about how you can change those coping strategies to make you healthy. If you've got any questions regarding this, please feel free to get in touch with us. And if you wanted to see some more resources, check out our website. Thank you very much.